The definition of Alzheimer's disease is a progressive mental deterioration that can occur in middle or old age due to generalized degeneration of the brain. According to our textbook, every 67 seconds, somebody in the United States is diagnosed with Alzheimer's. African Americans are twice as likely to develop Alzheimer's disease over white Americans, and almost two-thirds of individuals with Alzheimer's disease are women. The incidence of Alzheimer's disease doubles after the age of 65. Severe head injury can put an individual at risk for Alzheimer's disease, and the 4 lifestyle factors with the highest correlation to Alzheimer's disease risk include physical inactivity, depression, smoking, and midlife hypertension. In a healthy brain, there are neurons supported by microtubules which will guide nutrients and molecules between cells and axon terminals. We all have proteins called tau proteins that are responsible for the stability of microtubules. This protein in an individual with Alzheimer's is changed by chemicals and will result in tangles that will cause disintegration of the microtubules, making them break down the neuron transport system. It is the destruction and the death of the cells that will cause memory failure, personality changes, problems in doing our daily activities, and other features. Inside the Alzheimer's brain, you'll see the cortex will shrivel up, degeneration will occur in the hippocampus where we form our new memories. There will be a number of plaques often correlated to what degree of mental deterioration the patient has. Granuvascular degeneration occurs and will result in filling the brain cells with fluid and granular material. Brain atrophy occurs and is seen with a wider cortical sulci and enlarged cerebral ventricles. The earliest symptom of Alzheimer's is impairment of memory and learning. You will also see denial, which is an unconscious protective disease defense against the terrifying reality of losing one's place in the world. You'll see confabulation, perseveration, amnesia, aphasia, apraxia, and agnosia. Here listed are the 4 stages of Alzheimer's. The first stage is mild or forgetfulness. The second stage is moderate or confusion. The third stage is moderate to severe, and the final stage is late or end stage. These are interventions that nurses can use for Alzheimer's disease. Speak slowly and use short, simple words. Encourage reminiscing about happy times in life. In the patient's room, it needs to stay well lit with clocks, calendars, personal items like family pictures that will remain in a clear view of the patient while they are in bed. Label all rooms and drawers as well as often used objects. Allow the patient to perform as many tasks independently as possible. These 5 medications you will commonly see in a regimen for a patient who has Alzheimer's disease. As nurses, we can help our patients reduce their risk of getting Alzheimer's by having them stay physically active, stop smoking, avoid obesity, reduce inflammation, get enough rest, and avoid chronic stress and depression.